Tuesday, last week, Hennepin County declared racism a public health issue.
Yeah, one of the directives that the board gave was to push for policies that would improve health outcomes for Black, Indigenous, or other communities of color. Now, we all know COVID has sure shined a light on the health inequities that have long existed. But how does racism affect health? That's a good question. Even before North Point Health and Wellness began testing for COVID in April,
over 90% of our patients are from the communities of color.
Its CEO knew the impact would be personal.
We do know so many of the people who are impacted are our family members or our friends and our neighbors.
The positivity rate statewide for COVID is around 7%. At North Point, it averages 1/4.
I think it's important for people to understand the root cause of disparities. The underlying root cause is racism.
Look at life expectancy in the U.S. For whites, it's 79. For Black people, it's 75. There's not something biologically different about our bodies.
Right. So that's exactly right.
Rachel Hardiman is a health equity researcher. Her main area of focus, why Black mothers are 3 to 4 times more likely to die during and in the first year after childbirth.
These aren't new issues. I think they have been highlighted in a really important way.
Because of COVID and because of George Floyd.
One of the main things that's important to understand is the weathering hypothesis.
Researcher Arlene Geronimus came up with the term in the 1990s.
She, in her studies, found that the cumulative disadvantage of experiencing racism and microaggressions.
The impact of living in a society where racism and inequity causes trauma.
And can cause chronic stress, which can bring about hormones harmful to the body.
Physiologically breaking down the body, making it more susceptible to injury, to disease, to chronic conditions that we know are going to shorten someone's life.
Another big issue, says Hardiman, discrimination in the broader system and at the individual level.
We see this implicit bias or implicit racial bias that is showing up in a clinical encounter, and I think they're both incredibly important to understand.
She points to Serena Williams's life-threatening childbirth.
She says that had she not insisted on receiving a CAT scan, she could have died.
We've found a ton of different stories, both here in the Twin Cities and across the country, of Black people who are Black women who have had really concerning experiences during the birthing process, of not being heard by their provider, not feeling like they can trust their provider.
They're often not believed when they complain about certain symptoms, or they're just kind of like dismissed.
We have to be really thinking about why that's happening. There's a distrust and a mistrust between a lot of communities of color, and the Black community in particular, in healthcare systems.
And among this COVID talk of underlying conditions,
hypertension, obesity, and diabetes. Those are more likely to be found among African Americans.
Hardiman says we have to look on a much larger scale.
We think a lot about where you work, live, play, and how that matters for health. It's tied to your access to education, where you're able to get a job, environmental factors,
or access to nutritious foods or health care.
Oftentimes people want to blame the individual as to why they're not healthy. They need to understand that it's complex.
And that's part of why North Point offers not just physical health resources, but mental health, housing, food.
It involves a number of social as well as economic factors. It's a long-term fix.
And both experts told me that some of these larger changes, like Hennepin County's declaration about racism being a public health issue, they are necessary to bring about new policies and bring about more change. But they also said there are individual changes that are needed as well. For example, Dr. Hardiman is working on anti-racism trainings for current medical providers, as well as making sure that more students of color can go to medical school.
Heather, the experts you talked to thought the fact that there was a declaration by the county that there was meaning in that?
They absolutely, both of them absolutely did, because that's where you can sort of change those policies, they said. And as you see, Stella Whitney West at the end of the story, the CEO of North Point, which she was talking about, says that this is a long-term fix.
Right.
And, you know, that's one of the first starts towards working towards it.
Yeah, very interesting.